Hello and welcome to the JCN Clinic podcast show. I'm Jessica.
And I'm Carissa.
And today we are joined again by the lovely Danielle Renee, who is the founder and director of Bobbie Charles. If you've a long-time listener to the podcast, you will have heard Danielle join us previously for a really interesting episode, and I'll make sure I link that in the show notes. But thanks for joining us again, Danielle.
Oh, it's a pleasure to be here, ladies. I love working with you guys. I think that you do phenomenal things for women in health, and yeah, I'm happy to be here.
Awesome. Love it. Love it. Love it. Well, today we have you to hopefully actually have a few more to roll here as far as podcasts that we'll be bringing to our listeners as part of a skin series overall. And today we're going to be focusing on acne, which is a huge topic on its own. We were just talking before we started about how we're going to knock off a couple of topics today, but then we decided this is big on its own. It needs needs its own focal point. So it's going to be a really good discussion. So Carissa, would you like to kick us off with our first question?
Perfect. So let's get into it. Acne, Danielle, in your world, do you want to give our listeners an understanding of what it is and just how you guys see it present, how you see it present as a skin therapist?
Well, it's really common. It's one of the most common things that we see from a clinical perspective. It's essentially, without getting too complex, it's essentially where a skin condition where the hair follicles get blocked, and people often refer to the blockages or that kind of thing as your open pores, right? So you see them on the skin all the time. Or in large pores. So often with acne, it's going to present in multiple different ways. You've got your blackheads, which we all know, your whiteheads, and then you've got your papules and pustules. So, when you see somebody or you wake up sometimes and it's got it's not a whitehead, but it's got the inflamed area and it's got the white component to it. And then you've got your nodules and your cystic side of things. It's important, I guess, to know what you've got to know how somebody is going to treat you. I think if it's our skin, we should definitely understand how it should be treated. That way, if we go into a clinic and they're trying to do all different things, we also have some education and some knowledge to know, this sounds a bit fishy. Because one thing I see in the industry quite a lot is acne is so misunderstood still from a clinical perspective. So, for example, going into the next area a little bit here, but for example, you might go into a clinic if you're suffering with acne and it's already quite inflamed, and then they introduce a lot of acids and stuff to the skin. So, which is of course going to make it more angry. However, people that are fresh in the industry, that's essentially what they would get taught most of the time. So they're just doing what they get taught. But we really need to understand what type of acne it is and also what grade. So they put it into 4 different grades. You've got your mild grade, which is a few little spots. And then you've got your mild to moderate, which that's when you have more redness in there. And then you've got your stage 3, which is definitely more moderate. So there's more papules, pustules, that kind of thing. And then you've got stage 4, which we don't normally treat from a dermal clinician side of things, which is widespread, a lot of cystic acne, that kind of thing. We'll still definitely support the skin if they're going to see a dermatologist or something and looking down the Roaccutane, isotretinoin side. But essentially as dermal and beauty therapists, we normally would treat stage 1 to stage 3. And if there's any dermal therapists or beauty therapists listening, it's so important to actually understand that, so then we can tailor a plan for that client, knowing what grade it is and what type of acne it is. So that's essentially what it is it's just a common skin condition. It is a medical condition. And it's not something we can completely cure, but we definitely want to slowly prevent it and stop any, scarring that may come through after somebody suffers with acne as well.
Yeah, that's even so good in itself, because I think I definitely see, I don't know about you, Jess, but I know because I do so much skin in the clinic as well, I definitely see the gradings. And I didn't actually know that there was a differentiation in terms of, that they were actually staged the way you just explained that. But I 100% know someone who's got full-blown cystic, their whole, almost their whole skin biome surface is red, inflamed and reactive in some way, whether it's, pustules and, just raised red bits, down to someone who might just have like a little bit of, chin stuff going on. Yeah. So it is interesting that it is graded in your space. Because I didn't know that. So I've learned something. So that's great. But definitely, like, I talk to my clients, especially when because we do a lot of online consults as well. I'll get my clients to send me photos. So someone will just say, oh, I've got acne, and I'm like, cool, can you explain to me how it presents? So so I know where they're at with their journey as well, and then who they're seeing aside from me in your space. So
and I'll just touch on too, Carissa, that it's always better to treat it while it's in the early stages.
Yeah.
Early prevention is a lot better than getting it once it's at that moderate to severe side, like anything in life, right?
Yeah.
If you start treating it straight away, obviously it's not going to affect their mental health as much, their psychological state, but it's also going to minimize the chance of having scarring, which that can impact them their whole life. Whereas acne, it's not their whole story. It's just like a little component of their life. You know what I mean?
Yep.
So true. And but then often, of course, when you speak to the mental health side of something like acne, even though like technically it's just a small aspect, like it's so overwhelming, like it's just such a huge, but not for everyone, but obviously I'm sure you see it a lot and we see it a lot with clients, like it's just all consuming. It's not something that, we can all have different types of health conditions going on, but a lot of what can happen for people is going on internally. But when it's something that presents so profoundly externally, it's just really, really hard, which, is a whole nother area, I guess, when it comes to acne with that emotional, mental health component.
But you often hear, like, people will say, I'd love to hear what you guys hear, but sometimes people will say, oh, and especially women, I just don't feel attractive. Or I feel dirty. Or nobody's looking at me anymore. Or when they do, I can see them not looking at my eyes or my mouth when I talk. They're looking at my acne.
Oh, it makes me feel so sad.
It is, it is. And like, if anybody's suffering with acne, I just want to remind you, it's not your fault. It's it's a genetic thing. It's like, we'll unpack that now, and your beauty is so much, this is going to sound fluffy, but your beauty is so much more than just what people see. And it's your smile, and that's what lights people up. And I think when you see an acne client, they'll often have their shoulders forward and their chest in and their chin down, and they don't want people to look at them. And very rarely do they smile. And we all know that a smile lights up the room. So I think it's really important to remember that first and foremost, you are not your skin.
Well said. To what Carissa was saying too about the different grades, like I love how you're talking about moving through to grade 4 and it being something that is looking at like a further management process, because it's like that respect of what else, like the level that is driving that. Like it's not like the other grades don't still have contributing factors, which we'll get into. But I think that's really important, that it's sort of like looking at the sort of level of seriousness of the condition by the time it gets to that, and the level of intervention that is most likely required. But I guess as nutritionists, like to speak to that, it is such a wide kind of basket of potential drivers. I think if we had to sum it up, probably the main two components are going to be hormones. And then probably within that, you mentioned genetics, like genetic predispositions with hormones. And then the second big area would be the gut. And then really the gut and its flow onto detoxification and how there can be such an impact there. So I think for us, when we see clients presenting either with acne as their main cause or if it's part of what's going on, like we're always going to dive deep into, okay, what is this underlying driver? And I know for myself, and I'm sure Chris has seen the same, like often it can be a mix of the two, but it definitely can sometimes just be one. Like sometimes I've gone in thinking maybe this is more hormonal, but like as like I've started with the gut and unpacked the gut and worked there, it's actually been all gut. And then other times like you work with the gut, and so often we'll see a huge flow through to improvements with hormones as the gut health improves. But I've definitely had clients where they've had, say, 50-60% improvement all round in other symptoms, but their skin hasn't had any sort of impact until we've then taken the next step and looked at hormones. So they'd be the sort of two big areas. I don't know if you wanted to add to that, Rissy.
Yeah, definitely they're the two big areas. And obviously gut, like with gut comes the diet side of it too, because we know that with acne in our space, I know you guys talk about this with your clients as well, but there definitely are some key common drivers that will push that acne space, just even from a dietary point of view, and how obviously food, you know, plays in the gut level. But the genetic component of it is definitely quite big as well. I know you guys started talking about that before, and from the hormonal side of things, definitely, like usually I think when there's a gut perspective of it, it may not be as genetically driven. It's probably more diet. There's some diet and lifestyle factors definitely there that will contribute to it, but there's usually some sort of I would say genetic component regardless, because you don't just get acne for no reason.
True.
Right. But when we're talking about the actual hormonal, the pure, true hormonal clients where their acne is, you know, completely hormonally driven from an internal perspective, there's some pretty strong genetics involved there. And it's got to do with like our androgen detox pathways and what sort of metabolites we produce. And that's something that we work quite heavily with in the clinic and what we see. But the big thing that I say to my clients is once we're working in that, and it's gotten to that stage where we have acne, you need that whole team approach, because as nutritionists, we can do, like Jess was just saying, we can spend so much time unpacking the gut, unpacking the hormones, and we do a damn good job at it. But it's not a quick fix. Like by this time, this is what I say to my clients, like your skin is your end stage reaction. Okay. So if you like, and I don't know if you agree with this, Danielle, but like, yeah, but like when I say to my clients, by the time something is pushing through your skin, and we've got that compromise, you know, gut, hormone, skin, biome, like all of that space is compromised. The journey started a while ago, you know, and this is the end stage result. So as nutritionists, we're going back and we're kind of like peeling back all the layers and getting to that root cause of it. But that can take, like I know with my acne clients, and I wish I could I know a few of them will listen to this and go, oh my God, yes. It can be 18 months worth of work when we're talking about gut and hormones, and just, you know, just sort of like, if it's a balloon that's been blown up, we've kind of just got to slowly deflate that balloon so the skin has time to sort of, you know, decompress and heal and do all of that. But you've got to have your side, Danielle, you've got to have you guys in there as well, because like the damage that then starts to happen topically beyond gut and hormones is this whole skin biome as well. I always say skin biome. I hope I'm referring to that right, but that's how I say it to my clients. You know, and then so you guys have to come in from the outside as well, and just same thing as what we're doing from the internal. It's like this with acne, I feel like this whole light of just calming sandwich, just pressing from both ends.
It's so true.
Yes, calming sandwich. I love that. I'm going to use that whenever I talk about you guys and refer. You need the calming sandwich.
That's so bad.
Yeah, no, I definitely agree. I could listen to you guys for absolutely hours, but yeah, I definitely agree. And I think what you guys cover most is the internal factors. And so, you know, to touch on the external factors that aren't hormonal or gut, you know, people could be using crappy skincare, which is clogging pores or irritating the skin.
Yep.
You know, if it's not formulated correctly, So that's where we're looking at the brands that they're using and, discussing that sort of stuff. Environmental factors, as you guys know, you've got your, dust, pollution, humidity. Like you see it straight away. When I go to Bali, my skin just goes downhill dramatically. So yeah, that's another point, I guess, of understanding our clients better is, making sure if they're going on a trip that it's going to be high humidity and dust and pollution and that kind of thing. It's really important to make sure they've got good stuff in their kit when they go. And then you've got obviously your lifestyle habits. Like we're big on the skincare coaching in regards to making sure they're washing their pillow more often than they would normally and, disinfecting their phone. Like you touch that all day long and you touch everything else. Sometimes you're even using your phone on the toilet. Like seriously, I don't know about you guys, but I've been a sucker for it in a rush. And you're touching everything and then you put it on your face and right next to your mouth. Like, isn't that gross? Isn't that gross?
Thought about it. Like the pillow thing, I know. Like, I don't, again, it's something I've totally forgotten about and it's off my radar.
Wipe it. And even people that wear glasses, like how often do you disinfect your glasses? Like you're touching them all day long, like pushing them and touching them and you're touching everything and then they sit around your face and and right near your eye, which is a very sensitive area too. So I think like things that are coming, I'm not a germaphobe in that way, but it's if you're looking at those kind of things, the factors, definitely the phone. Definitely. Wow. But yeah, even your makeup brushes, making sure you're washing them as well. So they're the type of external factors that are normally going to cause more inflammation and clogging of more pores or, excess sebum production. It will cause that if you're in a high humidity environment. So they're the things that are going to make it worse from an external factor.
Yeah.
There's such good tips. I just find it fascinating because like there's the things that Carissa and I think about that it's just like, oh, of course you do ABC, but you just listing those, it's so logical, but there's so many of them I'm like hanging my head in shame. So I'm just like,
and even, when you see
God.
I see it all the time at front counter. We've just done a gorgeous facial and then they're going, oh, I don't know. And they're touching their, and I'm like, please. Don't touch my clean face. It is now my face because I worked on it. You've got to get used to not putting, your thinking hands on your face.
Yeah. I'm always like such a bad habit. That's why I won't even get into it.
I just exactly. It's just the things we don't think of. Yeah. Like I wouldn't have even thought to disinfect my glasses. Never. No. And they're just these things. I do not take care of things. My phone and my glasses, they get thrown around. They just like sit everywhere. Oh my gosh. Yeah. And I think it's important too, because like if you've got acne, you have open, like I don't want to use the word sores, but you've got open wounds essentially on your face. So bacteria just becomes so much more important in terms of management, doesn't it? Like I just, again, wouldn't have even thought of that, but you're so bang on. So,
and I think can I just touch on this real quick? This is obviously your domain. When I was doing my research, I was like, all right, what are the big contributing factors? And it's like internal and external. Obviously internal is you guys, right? But normally I find when I'm talking to the internal side to clients, but while I'm referring to you guys, the biggest thing I say to them, like we all in today's society are busy and we're stressed. All of us. Like it's aging us so fastly, by the way, but also it's causing breakout in the skin. And so I always say to them when I'm talking and coaching on stress levels and mindfulness and stuff is every time you're stressed, I want you to ask yourself, is it worth an extra line or is it worth an extra pimple?
That's a good way to put it.
Keep it that simple. Keep it that simple. So when someone pisses you off and you start reacting, it's like, you're not worth an extra line.
Yeah.
No,
not worth so true.
No, this crease doesn't need to deepen because
piss off.
No crease.
Creases.
Yes. I love the idea of the sandwich. Like I think it's really good visual because again, I'll talk to clients about this and it's so magic with where you come in, Danielle, because we're doing so much work on the internal, but as Carissa said, I'll talk to clients about how our skin is like this, this big detoxification organ. We don't think about it that way, but I'll refer to it like an end point. So it's like you need to do that internal work and give it the time for that sort of external to kind of show the benefits. But when you come at it for that sandwich and like come at it from the outside as well and think about all the external things that you can improve with what you're doing and what you can do as far as different types of therapies for your skin externally, like we definitely have seen many clients benefit with like getting the results quicker. Like it just makes sense. So yeah, I think it's a really valuable way to think about it.
Hey, one thing we haven't touched on, guys, is like the sleep side of things as well. Because that's a huge, if someone's, stress is obviously a big thing, but it goes into like the internal side is if someone's not sleeping well, they don't have time to repair.
Exactly.
And that's what your skin needs the most. So if you've got a client that's coming in there, or I've got a client that's coming in my space and they're really stressed and they're sleeping poorly, even if we fix their stress and we got great skincare and working with you guys, if they're sleeping 3 or 4 hours a night, you're pushing shit uphill.
Yeah, it's true.
It's
no,
true.
You are.
It's true. Yeah. You're allowed to say it.
No, I can speak to this personally. Like this is one of my biggest areas. Like if I don't get enough sleep, and part of that sleep is like, maybe stress related, but just in general, like when I wake up, like that'll be the time that I feel like I'm most prone to getting some form of breakout. Even literally this morning, I woke up because I had a bit of a crappy night's sleep and I was worried about getting up to get in a session before the podcast. And I hadn't even looked at my face, but I went out and did my session and came back and I was like, had my phone to do a recording. And as I was recording myself talking, I was like, what is that on my face? And it was like this big red mark next to my nose. And when I went into have a shower finally, I'm like, damn it. But it's so common that I will see that flow-on effect when I'm not getting that recovery while I'm sleeping. I'm not detoxing as effectively as a result, that I will wake up and be like, yep, there you go. There's a couple of spots just to remind you that you need to chill the hell out and stop stressing.
Hey, can I ask you girls a real nerdy question? When people sweat, is it only bad stuff coming out or good stuff coming out as well? Is it? Do you know
question.
The answer?
That's a bloody good question.
I think it's
because I was looking at sweat and gym because that's an external factor.
Yeah.
Right? And putting your face on someone else's ass sweat.
I don't think we should think of sweat as bad, to be honest.
No.
Like what we're sweating out is like part of like what our body is excreting, but I don't think there's anything bad about it, whether it's like through to certain minerals that we're losing depending on the intensity of like the sweating, obviously from an exercise perspective. I know there can be some pretty potent odors that can come with that depending on like all sorts of factors, the last time the person washed, how long they've been sweating for. And then also Carissa and I will see this a lot with clients, not so much with telehealth anymore, but like the more, what's a nice way to say it? I can't think of a nice way. The more toxic someone is, the more they have going on internally, like more endotoxin production, like they will have a stronger body odor present to that. But I still don't think about like the sweat itself as being bad. I think it's just like probably more so about how long you let that then sit on your skin and then the effect of that sitting on your skin and how that builds up and affects the skin's a bit like more, you would know more about that, like how it's affecting then the skin, because there's like a bacteria element to that too that can then thrive. Actually, even I can't believe how much I'm throwing myself under the bus today, but as an example, I had this in relation to sweat from doing a race and putting on, like I use Vaseline, it's the only thing that's helped with chafing. And Damien slapped it on, and as he was slapping it on around here, he actually put some in my armpit, and I ended up like, because I was sweating so much over the hours, and then the sweat obviously couldn't
you know, like
escape
with a
or breathe.
folliculitis or something.
Yeah. Like I ended up with these big lumps, like these big nasty cystic type lumps in my armpit that just were there for weeks, and they were moving around. And the only thing that got rid of it in the end was putting like oregano oil directly onto it. But yeah, it's just a kind of extreme example of how like my sweat wasn't bad in inverted commas. It was just that
Your body wasn't able to get rid of it.
I wasn't able to get rid of it. It wasn't able to breathe. And then I put like a coating on top of it, and then the bacteria were trapped. And yeah, so that's a long answer.
No, but I feel like I do think like our sweat will, again, be interesting maybe to ask some a sweat analysis expert, but I do think our sweat would 100% contain toxins and stuff though. Like, you know, like it's an excretory process. Yeah. And I know when I've done work with some, again, more, I hate using the word, what did you say before, Jess? More like toxic people.
Endotoxins kind of like production.
Yeah, like, let's say toxic people, but just people whose detoxification pathways are compromised, or there's so much stuff going on internally. We're not saying toxic as in toxic traits, but it sounds really bad.
You're toxic. I want you out of my life.
But I know, so say for example, like I know when I've had clients that I know their detoxification pathways are fucked, like you can see it in their genetics if you do genetic testing, they're constipated as fuck. So they're not, okay, so I'm just trying to get, okay, but I'm just trying to give you an example of someone who is not detoxing well. And you support them to
You're
detox.
full of shit, practically.
You're literally full of shit. And I've had clients like this over time. And we have jokes about this in the clinic, so I'm not throwing anyone under the bus. I've literally used those words with my clients and they will agree. And we upregulate. So we obviously get their bowels moving effectively. So they're detoxing one way. You know, we get them drinking appropriate amounts of water. So their kidney function, flushing, all of that is happening. And then we hit their liver and we get in and do some liver detoxification, whether it be of estrogens or androgens or whatever. They might have some, you know, extra baggage going on in there. But I tell you what, the change in their sweat and what is coming out through their skin is foul for some of them. Like I've had clients. Yeah. So again, like I'm not saying the opposite to what Jess is saying. I just think there's definitely things that have to come out in that sweat, and it can be, I don't think we need to be worried about it because of the body's essentially detoxing. But I have seen those changes in clients and had those conversations where I even had one client when we started detoxing estrogen, it was almost like she could smell it coming out of her skin. Like we just upregulated her liver, you know, her phase 1, phase 2 detox. We had to back it off because I thought it was a little bit too much. We had to really back it off. But she was almost getting, like, it sounds gross, but like a film over her. She was sweating so much, like just with walking. She would get a film over her that she said was just bad. Like she had a lot of detoxification issues. But just that, and we just like touched on her detox pathways and upregulated it. And she just said like she would have to go home and shower because the smell coming out of her, like just from a sweat, gross. But yeah, she said it was just literally seeping out of her pores. So extreme example.
No, but it's true. It's like your body does keep the score. It's like everything that's going on internally, like it's for a reason, and everything that's coming out is for a reason. Yeah, I think that's so important.
Yeah, I think like, I agree, 100% agree. We don't need to be afraid of sweat, but I think for some people, some of the shit coming out, probably similar to yours, Jess, like this client was just more stuck internally and then we started pushing it. Like she was showering, like I was having her showering a few times a day and dry brushing and all the things. But like.
Wash your face, guys. Wash your face.
Wash your face, wash your phone.
It's definitely a sign / a symptom of something being like out of balance, essentially.
I get so jealous, guys. My mum, this is my sister, off topic, but my sister does not sweat and she can be in the same, and I'm a sweater.
Me too.
I hate it. I'm like such a sweater at night. I'm like hot instantly as soon as my body starts falling asleep. I've always been a sweater, but my sister, nothing. I'm like, you're not working out hard enough, but she actually does not sweat.
Oh, wow.
It is strange, isn't it? I know my husband's like that. He doesn't sweat. Like we'll be in Bali and I'll be like dripping saturated, and he'll be like, oh look, and like he'll have this tiny bit of beads in his just in the crease of his elbow, and he'll be like, oh, I'm sweating.
Yeah.
Oh my God. I actually, again, it's an interesting fact, like whether is it genetics, but then, you look at you and your sister, he's from New Zealand, so I don't know whether he just thinks like there's just something, actually that doesn't make sense. I was going to just say something really nasty about where he's from, but like
we're on record.
But yeah, I've been asked that before, and I don't actually know why some people just sweat more than others. Like I think it's more of a problem, obviously, if you're a sweat, like we're just talking to, if your sweat's like very odorous. Like
guys, you can get anti-wrinkle for excessive sweating.
I've heard that. Yeah.
I've had that. When I was a young girl and I was going for interviews back in the day, I would always get sweat patches.
Mm-hmm.
Like I was just a sweaty. It just sucks. And because you think it's so not feminine, right? Anyway, so many women get anti-wrinkle or whatever under the arm. I can't call it anti-wrinkle now with the new legislations, but anyway, they get medical stuff under the arm to stop them from sweating.
I would need that all over my body.
Yes.
Particularly here. I'm such a sweater here.
What is it you can get in your palms? Like, for people get the what's it called with the sweating? Like, is it
hyperhidrosis? It's the same thing. Yeah, you can get it in your palms. You can get it in your hairline.
Yep.
So you don't, like, in the head, because a lot of people get sweaty hair and wet hair.
One of my girlfriends has had it done in her palms because she's a yoga teacher and she's excessive sweater, but just on the mat, especially when she's teaching and she's a bit more nervous. And dialed up adrenaline wise, like her palms will just sweat, like it's just crazy. And I think she's had it done in her hands just to dial that back a bit,
so she doesn't slip around on the water slide.
Water slide on a yoga mat. Really? Oh my goodness.
Do you know that was, side note, that was my first ever client in like college, uni, whatever you want to call it, because like at the end of our degree we have to do clinic clinic prac, and you go in at first and you're just observing, and then there's got to be this first time, it's like your first client. And I remember the lecturer saying to me, no, you're ready, Jessica, like someone had come up and they wanted a treatment. She's like, no, I think you're ready. It'll be really easy. It'll be fine. Like, just go in. I've got faith in you. And I go in, and it's this guy who's there literally for hyperhidrosis, right? That's how you say it. Did I say it right? Hyperhidrosis. Like, that was his reason for being there. And I'm like,
I don't know how to treat
my God.
Go and get some anti-wrinkle injections, bro.
It is such a thing that affects your confidence, though, because you don't want to get nervous, because when you get nervous, you sweat more, and then you get more nervous, and then it's like,
yeah.
They're going to be able to tell I'm nervous because I'm sweating.
It's like if you're someone, I don't get it often, thank God, but I get the face flushing, that nervous face flushing.
Oh, you poor
and just
bugger.
the blotches, and
I hate that. And I don't get it, but I just, when I see people that go red, I'm just like,
that's me. Darling. And it'll just happen for no reason, no rhyme or reason. But as soon as it's triggered, like there's just no stopping it. You just feel it start about here, and your whole face, your ears and everything. And I can be chatting to a client and it will happen. Like, just, I don't know if it's just a day I'm a little bit more anxious or something like that. And it's, so similar to the sweating, you just, once it starts, you can't stop it. The more you think about it, the more it happens. And you're like, oh my God.
Oh, God.
Anyway. We have gone off topic. Back to acne, team. Back to acne. I know we sort of have started talking about this, and you obviously touched on, Danielle, like some of the environmental things you would talk to your clients about treating it. What would, like, obviously for Jess and I, we go in, we're definitely assessing and addressing whether it's gut or hormones and or both, and then going in and working in that space. We utilize and I know I've chatted to you and your girls about this as well, like if it is definitely hormones, I love using the Dutch test if it's affordable for someone, because it just really highlights whether or not for someone their acne is purely androgen driven, or whether or not there's some estrogen detox issues or estrogen excess issues as well, and how much of it is liver, how much of it is just genetics and liver. So we're going in, working in it from that space, and we're just, as I said, it can be 6 months, 12 months, 18 months, like the skin journey, depending on how progressed it is. for us, can take a while. And then from a dietary point of view, we're definitely looking, like, I don't want to name and shame foods, but the 3 biggest groups for skin for us, I'm going to speak for us, Jess, is that okay?
You can go for it. I think we might be aligned.
Is I'm going to say refined sugar. Like, it's just got to go if you've got skin stuff. I'm just so cutthroat with my clients about that. Like, you can't be adding vanilla pumps to your iced latte every day. You can't be having sneaky little treats. I hate demonizing food groups, but if we are working with skin, sugar, no, I'm not talking about fruit. I'm not talking about beautiful natural sugars. I'm talking about refined sugars. It has to go. I'm really cutthroat with my clients about that. Shitty saturated fatty foods. You can't be eating crappy takeout, oily, gross foods on the regular and expect that not to impact your skin. Like, that is a big one. So if you're sneaking out and having, Betty's burgers on the weekend and having a bowl of chips and aioli or calamari and chips and then having a pizza midweek, just that, again, so fine in moderation. But if we're dealing with skin and that's something that's in your diet more than once weekly, it's got to go. And then the other one, which I've always put a little bit of hesitation around because this is definitely client dependent, but is dairy for skin. There is just, it is just such a trigger in my mind and eyes for a lot of my skin clients. And there's definitely for majority of them, there's going to be a removal of it for some, strict point in time, with the goal to obviously bring it back to in some degree if it's needed. But yeah, they're my top 3 things that I'm looking at. Anything else in your book, Jess?
No, nailed it. Absolutely nailed it. Nailed it. I'm thinking of a client example, but I'm going to hold on to it because I think you're rolling on to asking Danielle about what her toolbox has.
What's your toolbox, love? Where do you guys come out as skin therapists? Like, obviously you don't have to give away all your tricks of the trade, but just some things that are, do's or don'ts or...
At Bobbie Charles, we would normally work in phases, and it would genuinely all start with just a conversation. And so that would be performed over an hour consultation where we get to understand the client, the history of the skin, what they've tried before, what they're using topically, what are their stress levels, what is their toilet habits at the moment, not the phone, but actually going to, just really understanding what's going on with the client in that season of their life. And then at that stage, we're addressing which category it is, which stage it is. That way we can perform a treatment plan. And the goal there with that phase is just to really build that trust and to understand the client and tailor that program and get the commitment from the client, because it is a journey. It's not a sprint when it comes to treating acne. And then normally when we go into phase 2, that's the calming down the inflammation side. So normally we'll do a course of really high-grade medical light therapy facials, and normally that's for your first month, and just making sure that the skin is turning over the way it should, healing the way it should, responsive the way it should. I think we did light therapy on our last podcast, but it's so important to discuss it here for the fact of the inflammation side and the blood flow and the detoxification of the skin. So whilst topical products are only going on topically, the light therapy device, it's impacting like the cellular response. So, you're working from the inside out.
I've literally seen light therapy in, like, say if I've got a client and they haven't done it before and I've said, this is, you need to go see you guys. If they're not in Brisbane, find someone good that does this. And within like 6 to 8 weeks of me, just kind of the same thing, like I'll always go in and go, let's do like a bit of an anti-inflammatory, like calm things down before we start pushing detox pathways, changing anything. And just the light therapy alone, like a few sessions of that, the feedback is just so profound. I really I know I probably said this to you last time, but I feel like I just can't rate it enough for skin. Like redness.
Yeah, and it does depend on what sort of light therapy that clinic is using. Like we use a medical grade device that's used alongside, surgeons and hospitals and dermatologists. And so, that's one of our most expensive devices. But it's the foundation of all of our treatment results. So, the second phase is exactly that. So calming down that inflammation. And then the third phase is when we go into more of your actives. So we're looking to do some sort of chemical peel, and some people get frightened of the word chemical, but we have to remember, like, there's chemicals all around us. It's what makes us live at some point. So chemicals aren't always a bad thing. If used the right way and used with respect, that's what the skin will normally need. So then we go in and do your slow release chemical peels, and gone are the days where we used to get quite a lot of shedding and stuff from peels, depending on the formulation that's used and the brand. We have access to a lot of mild peels that give you a great result, but with mild shedding. So, you can go back to work the next day and it's completely fine.
Yep.
But when performed the right way and used with respect, that you get great results, not just from an acne respect, but from an anti-aging and brightening respect as well. And then we would then move into the next phase. Normally at around 2 to 3 months, we'd go into the next phase where we're looking at a healthier skin due to light therapy. We're looking at less breakouts due to chemical peels and the skin really healing the way it should. We then look at treating any scarring, or pigmentation that's left over from that acne. If people are pickers, normally you'll get that. And that's when we would use a different device, such as skin needling, with different sort of ampules and infusions that we've got to either stimulate more collagen, to smoothen out those pitted scars, or to reduce pigmentation and redness and stuff. So you're essentially just leaving a clearer skin, a healthier skin, a more vibrant skin. And then we would go into the last phase. So most clinics will stop at that phase 4. Okay, scarring's great, skin's looking good, off you go. Whereas with us, you're with us for life. So then we would go into your maintenance phase. So that's when you would want to always making sure that we're doing that preventative work again. So it just never comes back. So that's when you would go into you'd be seeing us less after that, just to make sure that, A, we're there to coach you still and keep you on track, but B, your skin's still responding the way it should. So that's, from that whole process, from a conversation, that consultation, to your maintenance phase, normally we'd normally request 4 to 6 months commitment from that client.
Right. Yeah, I was just going to ask you about the time frame, if you're able to give one. So
4 to 6 months, I normally say, just to be respectful to the client. I can normally get a really good result in 3 to 4 with the girls, 3 to 4 months, that is. But just to be, we can't control what they do at home.
Exactly.
So we normally say 4 to 6 months. But I always say to the clients, don't think that it's going to take you 4 to 6 months to see results. You should be seeing results within the first 4 weeks.
Yeah.
If you're doing everything that you're meant to at home and you're seeing the girls at JCN.
No, I love that. That's similar to what we say with respect to timelines. Like, people want, if you can give them some form of timeline. I know Carissa spoke to that, but yeah, it's not like if we're saying it takes a year to 18 months, like we are still expecting to see over the first couple of months, definitely some improvements to show that we're on the right track. So
100%.
I think it's really important to give people the framework of, like, this is a commitment of time and you need to do the work, like, at home as well, in all areas. But it should be a progressive work where you're seeing improvements as you go.
Just to wrap it up, just to simplify it for people, I think thinking about, like, your internals with the JCN girls, obviously, or just JCN, because you guys do virtuals as well. Hey, so it doesn't matter where they are in the country, same as us. We do free phone calls at any point. if you want a 15-minute chat with one of our therapists, even if you're not buying from us, we're here to help you. So I think looking at it from an internal perspective, hormones, gut, that kind of thing, diet, thinking about things from an external, what are you putting on your skin, both topically and your hands, your phones, your device, all of that sort of stuff. Where are you laying your face at night or laying your face during the day? So your pillows, where are you laying your face during the day, i.e. the gym? You know, making sure that your surfaces are nice and clean and showering, that kind of thing, getting rid of all the excess sweat. And then your clinical perspective, so where we come in, you know, doing your course of committing to that course, that treatment course, beside the course that you guys would provide. But yeah, it just all starts with that conversation with both of us. Yeah.
Wonderful.
Yep.
Love it. Is there anything else that anyone wanted to add? Like anything we've missed? I think that was a nice little summary there, but
yeah,
I feel like I think we've covered all areas. Yeah, Danielle, could you just let listeners know where they can find you, or of course Bobbie Charles in general? I'll make sure all this goes in the show notes, but just for people listening, if you could let them know if they're wanting to find out more.
Yeah, definitely. You can book in for a full hour consultation, that's what I definitely recommend. That way we can use our AI devices and see what's going on underneath the skin and how your skin's responding and that kind of thing. And tailor a program. That's for people that are really serious and they really want results. That one's an hour with our senior dermal therapist in clinic. And we have the two locations, one's at Lutwyche and one's at West End. West End is our more advanced space when it comes to skin. So, you know, if you can get to the West End clinic, I would highly recommend getting there, just inside West Village. Otherwise, yeah, you can book, as I mentioned before, a free consultation over the phone. So just completely free, 15 minutes, just to have a chat and be like, am I right for you? Are you right for us? That kind of thing. And yeah, if you just search Bobbie Charles online, you will find us in lots of places.
Wonderful. Love it. Thank you so much. This has been really informative, and it's so nice just to bring all aspects together. I know, I think Carissa and I have probably learnt some things today, particularly what not to do. And I'm sure lots of listeners have learnt a lot too. A lot of listeners are coming here, obviously, with that nutrition focus, but I think it's really important with this space to like consider all aspects and to consider the sandwich, as we've called it today.
No, I love it. It was so nice to be here, ladies. I always learn so much of you guys, so it's really nice just to pick your brains again. Yeah.
Wonderful.
And I think if anyone remembers one thing, don't stress, because it's going to add an extra line. They're not going to stress.
Great. Well, thank you so much. And we'll definitely have you with us again. And just as a teaser to listeners, that will be about the topic of rosacea, which I'm really excited to dive into with you.
Yeah, excited. Thanks, ladies.
Thank you. Thanks, listeners. And if you enjoyed today's episode, which I'm sure you did, please make sure that you share the episode on socials. And we'd love it if you could head to iTunes and leave us a 5-star rating. That means the world. But thanks for listening, and we'll catch you next time. Bye.
Bye.